Anyway, we're grateful that supplies have been donated by several places, and those I think came from Natividad. Did they?
Yes, we got Gary Gray, terrific partner in crime with Natividad Medical Center, and he is very, very instructive, as you know, on some of the healthcare guidelines and things like that. But he provided not only several surgical masks for us, but thermometers. The ones he ordered were absconded by the medical staff immediately, which were the infrared ones.
Right.
But we got probably 10, 15 thermometers to take to the shelters and start using there, which is terrific. And then the county's been great. They Anastasia Wyatt has really been terrific in organizing supplies to take kits. Okay. So these little wellness pouches have been very, very helpful. They have not only a couple different types of masks in there, but they've got hand sanitizer and some alcohol wipes, just some very basic sanitation supplies for people who are on the street. And what's been fascinating, we I think distributed probably 40 or 50 of these yesterday to some of our homeless in the Monterey side of our county. But the interesting thing, and Teresa, you know this too, what do you think are the impressions of the homeless about all this that's going on and all this fancy prevention stuff? What's your...
It's a mixed bag. We've got people that are really taking it very seriously and are having the same kind of fear that a lot of people are. And then we've got the ones that are kind of blowing it off. And I've even had one guy that was homeless said that we're never going to get anything because we've been exposed to everything and we don't get germs. But unfortunately, that is not the case with this one. It is not immune to anyone getting it, whether they're young, old, or whatever. So I think there's a mix. So we actually collaborated earlier and did a video about COVID-19 and the official infection control issues that are related to it and whatever. So the idea of having the right kind of hand sanitizer and how you wash your hands and the 20-second rule and all of that is real.
Yep.
And so what we're doing is we're really trying to provide as much as we can of those materials to our folks that are homeless, just like we're doing here at Chinatown, as well as in our other shelters, in the Salinas Warming Shelter, domestic violence shelters, etc., and the respite care, so that we have those kinds of things to help contain it and prevent it.
And
So.
consistent policies and procedures and all of them,
Right. Taking temperatures, making people wash their hands.
So funny story yesterday when I was handing these out is it's two guys were 2 feet from each other. We're 3, so we're much safer. But they're saying, so we're trying to maintain our social distance, but we're really, like you said, we're probably immune to everything because we've been on the street so long. We said, well, no, this is a respiratory thing that is a lot different. Oh, and by the way, the reefer that you're passing back and forth between each other is probably not a really healthy practice for preventing COVID. So, but it is interesting. It's sort of a mixed bag, and it's tough to convince people. Some of the social distancing. In fact, we had quite a conversation around the importance of community, even in our homeless community, which sometimes people would describe as very dysfunctional or very dangerous or kind of comorbidities, if you will. There, people are bound together by this homeless camaraderie, which sometimes is to their detriment. But at the same time,
it's their family.
How important that community is when you're trying to help get people in shelter or off the street, that you can't just do it in individual, you do it in community.
Right.
And it really helps. And by the way, as we were talking to one yesterday, having the same people that are struggling with alcohol addictions or drugs or so on to be going through AA or NA or something together.
Right.
And learning functional patterns, restoring lives, and so on, but in community with your homeless brothers and sisters.
So it really is, and actually some of the shelters, we find that those people do become family to each other. They're really important support systems, and we find that even after they've left the shelter, some of these people kind of stay connected to each other. And so part of what we're building in that community is relationships that they maybe never had.
You betcha.
And some of them we all grew up with dysfunctional families, but maybe some more than others. But so we're trying to teach them those skills of maybe they never learned to budget, they never learned to shop appropriately, they never learned anything like that. So part of our case management that we deal with in the shelters is helping people to maybe learn what they never learned when they were growing up. So
get back on their feet. Well, another thing we hear that maybe we can spend a little time on is it just seems like nothing's being done for the homeless out there. Everything's sort of standing still. fact, one of the rumors going around in Monterey was that the National Guard was going to come in and round up all the homeless and maybe they're talking about in the fairgrounds. There's all these things that float around, but the fear was that if they're going to do that the homeless are saying, well, a lot of them are talking about leaving town.
Right.
I'm going to pick up and go to another state then, and you're going, oh great, we're going to export
all the people.
thousands, 1,000 homeless that are on the street to Nevada or Idaho or
Right.
something else, who is no way ready for that kind of onslaught, nor would that be healthful to anybody.
Right.
But these kind of dispelling of these rumors are important. So
We even had that going on at our Salinas warming shelter there. We have actually gone to an in-house security group that's there, and Jesse Armento, who's our manager there, told the folks that we were going to bring in specialists, and the immediate thought was the National Guard. But they
Those
were
specialists.
the specialists we're talking about were just pure simple security, so that our staff and our guests are safe while they're staying with us. So.
Well, I mean, there are some exciting developments, I think, coming on board. It takes a while to get the funding and to get the public will and the political will and everything else behind these things. But one thing we did want to make sure people knew about, number one, I want to congratulate the community that's coming together
Absolutely.
in amazing ways. And it's unfortunate it takes a crisis sometimes to do that, doesn't it?
But it's working, isn't it? City, county,
city,
faith
county,
community,
faith community, our foundations, our
Yep.
coalition. People are talking to each other. They haven't talked to each other in a while, which is really encouraging. And you know what? There's dialogue going on between the homeless and the people who also are coming alongside and wanting to help,
Yeah.
which is again very healthy because it kind of creates an equal plane, if you will. So,
Yeah.
But as you know, we're pushing hopefully an agenda and funding to get a what they call a sprung shelter out back here.
One that springs like a trampoline and jumps up and down.
Yeah,
that's what people
we wanted to
think.
create a theme park, I think. So, but this is one of these, aluminum frame shelter with a very nice canvas covering, if you will, waterproof, long and durability. But I think it'll house maybe about 50 additional
50?
folks,
Yeah, that's
which will
great.
be nice. One of the things the health department has concern with is any large gathering places like that is separation,
Right.
because of getting in too large of groups. In fact, there's just an article came out of Japan of all things yesterday I was reading that says they ran into issues where they started putting people in gyms and housing them and things like that, where the infection rate went
Right.
up 20-fold
Yes.
because of again congregating people together. So in the sprung shelter, though, what we're maybe talking about is setting up actually tents inside of
that
the
was really
sprung,
exciting hearing about that.
which would be kind of cool and segregate people a little bit more there, while still getting people kind of out of the cold and the damp. So that's about 4 weeks to develop and put in place once the trigger's pulled, but that's a pretty quick time frame.
Did I hear the Veterans Transition Center might be involved in some of that?
Yeah, again, another great partner.
Great collaboration of people going on.
Yeah, love Jack over there, along with his staff, with Kurt Shockey, and who have got, as I said, about 170, 180 tents that are ready to go with cots, with blankets, with everything else. Boy, if we could put, if we have 80 to maybe 10 of those inside the sprung shelter. We're even talking about maybe using the police athletic building, building downtown Salinas here. Probably could put close to another 30 tents in there and house another 50 over there. That's again one where you got to keep people separated and so on, but it's got shower or restrooms. It's got facilities where people can wash clothes, things like that. So again, getting more people off the street. Perhaps one of the other more exciting developments too is in the city, again, has been terrific at this. Megan Hunter and Tina and her whole crew have put in some time back a petition to get trailers. These state trailers that they have theoretically ready to go, and we're a smaller town, so we didn't get in the first wave of trailers that were requested for LA and San Francisco and everything else. But a wonderful philanthropist has funded something close to 30 trailers, of which 8 of them will be housed here, where we may actually petition for more. But 5 of those will house 5 people, and 3 of them with family units will house 8 people. Got full showers, restrooms, everything built in, which is terrific, again, for isolation and that sort of thing. And I think what we're talking about maybe is locating those over next to the Al-Sal warming shelter and almost doubling the capacity of that facility again. So good news there. Again, it's just getting people off the street and housed and fed, and boy, people are just stepping up right and left with food.
Yeah.
And
Lots of donations, lots of people
Yeah.
really wanting to help, and we're grateful for all those,
Yeah.
aren't we? It's amazing. And I think what you said earlier is that sometimes it takes a crisis.
yeah,
People should have already come together already, but it's been amazing.
Yeah.
When bad things happen, it seems like God pulls things together into something that can be really promising. And I think that with the city and the county and all the other groups that we're talking about, we may make this happen.
yeah, yeah.
Everybody says, "What are you going to do about the homeless?" And I think that we are now at the point that it's forced us to really look at it.
Well, the good news is some of these solutions now can stay in place
Yep.
even after this
Absolutely.
this is
Yeah.
over, and it sort of leapfrogs us into some of the housing solutions that are on the radar screen too. And so, hoping, for example, when the year-round shelter gets finished out on Laurel,
Right.
that these trailers may in fact end up as permanent fixtures up there as an idea for housing for families and so
Right.
on. That we can start putting some smaller home units or apartments downtown here that again are convenient and get people off the street. But it's fun to think we can actually make a dent finally in homelessness. And it's
We've been talking about this for a long time, being on board together, but the reason we kind of coined community homeless solutions is exactly what's happening right now. And we feel like we're a big driving force with
Yep.
what's going on in the community as solutions for our homeless population. And wow, aren't we proud of that?
Amen.
Amen.